All right, and so now we're just, we'll start in a moment. We'll see how many people join us today, and then we'll start our webinar. Got a couple of participants coming in now. Jeez. There we go. All right, it's 8 a.m. mountain time here. I'm Dr. Glenn Kitteringham, the host of IFPO's International Global Webinar Series. So I'd like to welcome everybody to session number 6, Managing Stress During the Pandemic. And overall, our intent with this webinar series is to provide an opportunity for critical thought and discussion, engage with guest panelists, security practitioners to provide insight into their experiences on the topic at hand, and to identify resources for attendees to access it as it pertains to the sessional topic. And I just want to remind, before we go further into this, I just want to remind everybody that we have a Q&A function, as well as the attendee discussion feature where people can post comments for other people to see. And so, as I said, this is session number 6, Wednesday, July 21st, managing stress during the global pandemic. And so some people are possibly questioning why, you know, theoretically the pandemic is over, and yet I think we know from a practical perspective that it's not. There are still countries that are experiencing spikes in rates, and they're talking about a 4th wave. And they're talking about lockdowns again. And so we're all here in Calgary, Alberta, and we've pretty much had a relief, I guess you could say, at the beginning of the month where they've removed the vast majority of restrictions for the pandemic. And I think the only place that they're allowing or requiring masks in public buildings. So we're not out of the woods yet. So anyway, so with the immunization program in full swing around the world and the recognition that the pandemic is theoretically coming to an end in most countries, there's certainly still high levels of stress amongst the general population and with those frontline security personnel interacting with them. Pandemic-related issues are expected to linger for several months, if not years, not only because of the pandemic itself, but also due to the societal changes as a result of COVID-19. The stress experienced by security staff generally in dealing with the pandemic, as well as due to negative interactions with some members of the public when it comes to access control and rule enforcement, has created a double impact. So this webinar will focus on 2 issues. First, we'll discuss the elements of an employer-based pandemic stress reduction program. And second, we will discuss tactics available to individuals to self-manage stress. So I want to welcome everybody to today's presentation, and I particularly want to welcome my 2 guest panelists. And so, Jody, I'll turn it over to you.
Sure. Thanks, Glenn. I do want to apologize first. My voice is going to be crackly. I've been riding my bike for the last 3 days, and my computer tells me right now the forecast is 16 degrees Celsius with smoke. So that's why my voice is crackly. I'll do my best not to yell and scream. But good morning, everybody. My name is Jody Reed. I'm the security manager at the Bow Tower in Calgary, Alberta, Canada. I am with H&R REIT, and the Bow Tower is one of Western Canada's largest office towers. I started in contract security about 30 years ago and worked my way up to managing and supervising large teams within shopping centers and the high-rise environment. So looking forward to the conversation today.
Excellent. Thank you, Jody.
Thanks.
Doug?
Hi, good morning, folks. And Jody, great to see you. Thanks very much. My name is Doug Durant, and I'm a security advisor with the City of Calgary. I've been in that role since 2015, and I'm seconded to one of our portfolios, the Calgary Public Library System. And I'm specifically going to talk about that system today when we're in our discussion. That system, I've been in the security management industry for, well, I'll say 30 plus years. I'm board certified through ASIS International. I have my certified protection professional designation, criminology degree from Simon Fraser University, And I've volunteered with ASIS International, I think, since about 1997. I'm currently the certification chair for the Calgary chapter. So a long history, but looking forward to having a conversation today.
Excellent. Thank you, Doug. So again, Jody, if I can turn it over to you for your opening statement, please.
Yeah, sure. I think a couple of things that I, want to bring up, and I think you mentioned it at the beginning, Glenn, but, obviously I want to acknowledge that the stress is not going away. I mean, the time in which we live is stressful. The pandemic, I think, has added to the heighten of the highs and the lows. I mean, sometimes I think we've all felt like we're on a bit of a roller coaster ride over the last, couple of years here. And with the pandemic, to me, it's long lasting. There was really no escape, whether it was at work or at home. You were always kind of knee deep in it. And I think, as security professionals, we're often used to dealing with, what I would call like a business interruption, like some sort of event. Maybe it's a fire, maybe it's a fire alarm, maybe it's a stabbing on your site. But between the business interruption and the recovery, it usually happens within your shift or what you have to deal with, a day, a couple hours, where this just really went on and it is still going on for almost 2 years. And I think, acknowledging that the frontline staff were expected to go to work and continue to go to work. And it was scary. We heard from people taking transit. Was it safe to be on transit? Was I going to get sick on transit? Was I going to take it home to my family? Everybody left. The tenants left, management left, but security had to continue to come to work and be like it's normal. Be the smiling face at the front door. And then as a manager perspective, I mean, we were just told to go home one day. We had a meeting and told, starting Monday, go home and manage people from home. There was really no playbook for that. And I think when I look back and I think about, what I would call normal stress, how I dealt with it, going to the gym, going hiking, going camping, these are, things that you kind of just roll through life and you don't think too much about it. But as the pandemic went on, I mean, I kind of looked at it, some pluses and minuses, I guess. The opportunities that it did provide was opportunities to connect with some of the night staff that maybe we hadn't done for years. We had Zoom calls at my workplace, for every shift. So 4 times a week, talking to the night staff, meeting the night staff like I never had before. I think it provided security opportunity to shine in the early days. I mean, we are normally the collectors of data. We were able to share that data and reports, and we were the people on the ground to lend a helping hand. So that was huge, I think, in the early days. It wasn't extra work. It was stuff that we already do, and maybe we do, behind the scenes a lot of the time. Obviously, the downside, from a management perspective, it turned into super long days that really never seemed to end. My family was in the house. My house was my office. There was no getting away from anything. But I think as time went on, what I started to recognize as a manager was employees starting to have a bit more aggressive outbursts, stuff that I wasn't used to in the past, like saying things angrily, I'm going to quit. I'm leaving. I'm here all alone. Management, I'm the only manager on site. And from a distance, I kept thinking, well, I'm here, but I'm not there. Right. And so, maybe time gone by, some of these outbursts would have been looked at quite critically, but I think quite quickly you recognize that this is stress. This is people not dealing with stress, and it's starting to come out in angry outbursts. So we're all feeling it, and I think from a management perspective, virtually, we are expected to be the cheerleader. Like, it's okay, everyone, keep doing what you're doing. But at the same time, I kind of started to question, is this good? Is this okay? I had to put on a smiley face, but I was also recognizing that people weren't dealing with this well. So again, as the time went on, lots of promotion of employer programs, where in the past we might recommend it, but really, recommendation of utilizing those, talking to an independent person, because again, if you're stuck at home or stuck with the same people over and over, maybe your husband or wife or your roommate doesn't want to hear about how terrible your day is over and over again. You need to find somebody else to talk to. And that was really the promotion of the available benefit programs if your workplace offered it. I mean, I think about, through this, I started to worry about my job. Was my job safe? So then I started to think about my staff have to be thinking the same thing. I mean, I run a staff that's, some in-house, some contract staff. So I think, historically, if you don't need staff, you get rid of the contract staff. But I think it was important through this to tell them that that wasn't going to happen and then show them. I mean, we cut our staff in half. We sent half home to be on call if we had a situation where we had to isolate groups, even the contract staff, and even our contract provider was like, "You're gonna pay them to stay home?" I said, "Yes, please. Stay home. We'll pay them, but you have to be available. Like if we have an isolation incident where we have to send an entire team home, you need to come in." We talked a lot about normalizing asking for help, and that's not normal, which ironically, right? And I had to say one time through this, I'm not on vacation. I feel like as a manager at home, I'm in prison. I mean, I got into security because I like people and real people, not virtual people. So that was a big moment where, I think recognizing that we're all kind of in this together, recognizing, maybe in this life that's so fast, pandemic or not, we don't take enough time to self-reflect, time alone, shut off the distractions. It's hard. I tried it a couple times. Like I say, I like to go camping. I go into the woods and sit by myself, and that's pretty hard. If there's no Wi-Fi, nothing to do, sitting in the woods with absolutely nothing to do is really hard. And that says a lot about the life that we're living. We're kind of living this hamster wheel. And I think about the whole hamster wheel thing. And I just, for me anyways, I question, around really discovering what parts have we been doing that maybe we don't need to rush back to, what do we, I think it's a great opportunity to take a look into the future and just really ask ourselves, are we doing what we should be doing? Are there things we could be doing better, especially when it comes to mental health and taking care of ourselves? I think that's really important.
Thank you, Jody, for that. Doug, your opening statement, please.
Thank you. I kind of, when I was putting my opening statement together, I was really reflecting where we've been over the last 18 to 20 months. And as we can kind of continue on, it's almost 24 months now. And no matter what role we played in our career or our positions, as the pandemic rolled across the globe, we were impacted somehow by COVID and obviously some stress. As a frontline security officer where we're interacting with the public, there was a level of stress within the work environment. And then you add, always on a day-to-day basis, you have some conflict and stress, but now you add a pandemic into the mix and it's a whole different ballgame. And then I look, all of a sudden, some of our items that we were able to use as stress relief. So we couldn't go to our favorite restaurant. We couldn't go to a movie. We couldn't go to personal care services. So we couldn't get a haircut. We couldn't get a massage. We couldn't go to chiropractic, stuff like that. For Jody's perspective, manicures and pedicures, all that was gone. So, and those were things that made us feel good. It helped us relieve our stress from our day-to-day work environment, and they were all gone. Now you add in a family. Now your child's just been sent home from school because the classmate has tested positive or the school has shut down and closed. How do you balance between work, family, and what if you're the only bread earner for the whole household? How do you balance that, and what do you do? Same with our work environment. Our work environment's changed. All of a sudden, businesses were closing. As Jody mentioned, sometimes we reduce staff coverage, but how do you manage that? Now you've got stress because either you're financially impacted because you've been laid off, you've had your hours reduced. Maybe your employer has said, we need you to go to another location now, and you're working in a completely different environment, and that adds stress, and there's nothing you can do about it. But what about if you work in an environment where you have to stay open? So some of our businesses, some places could just lock the front doors and say, we're closed, and we have a security staff member there, but that was it. But what if you're working in a public facing environment? What if you're a first responder? What if you work in the hospitals? What about government services, city services, where you had to be there to help deliver public services to the citizens of your community? How do you manage that? How do you keep yourself safe while you're still performing an essential role? How do you enforce new policies and procedures at your locations while still minimizing conflict and keeping your stress levels down? You know, I kind of think about, and I put myself into some of our team at the library, and we'll speak to it later on, but how many times a day did they ask a person to please put a mask on and sanitize before they're worn out? You know, how many times a day did they face downright aggression or hostility when asked to do that before they were worn out? Or how many times a day were they were told, the pandemic's fake, vaccines are bad, before they're worn out? You know, our teams went home, and many of you may be on the call, went home just mentally exhausted. And how do you manage that? How do you recover from that and turn around and say, I got to get up and do it all the same thing the next day? You know, early on in the Calgary Public Library system, we started with what information we had from the virus. We all started not knowing a lot, and that was for everyone. So we started with the traditional PPE, some hand sanitization, additional cleaning practices, but we really didn't know a lot. But as more information came in, we started to quickly ramp up programs and supports to help our security teams and the library staff members. Putting that into context, how do we manage? So the Calgary Public Library System has over 600 employees. Majority are front-facing employees, and our contract security teams. How do we manage them? How do we support them? And we started quickly, and in April, we started ramping up our wellness programs. And I think we'll talk about it a little bit more in there, but we really looked at the first piece was a wellness program that had 5 components to it, was how to understand what stress is and how it impacts your physical, mental, and emotional wellness. What were the common triggers? What were your stressors? How did that affect your behavior? How was people coming into your building? What were their stressors, and what was that affecting how they were interacting with you? How do you prepare? So if I have to get up in the morning and go back and do it all again, what's my game plan to have the best likelihood of success for a really good, positive day? How do I plan for that? And then when I do have a conflict at work, or I am worn out, how do I cope with that? What techniques, what things can I do to help alleviate my stress so I'm the best I can be, both at work and in my personal life? We talk about our resiliency and how we build a plan to say, okay, I can cope with this and move forward. And you know what? When we started delivering that, great engagement by our staff and security teams. We offered that on an ongoing basis as one of our components in a total kind of protection plan for our teams, and it was very well received, and we're continuing to deliver that as we are today. So thanks.
Okay, thank you. So Doug, you just made a point that I want to ask both of you about, and I'll start with Jody, which is, do you think the pandemic exasperated an already pre-existing condition of everybody having stress? And it just highlighted the fact that people are under stress, or like, I recognize that obviously the pandemic has been stressful for all of us, but was there an underlying level of stress already that just simply wasn't being acknowledged?
Yeah, I 100% agree. I think, like I said, the pandemic kind of gave us the highest of highs and the lowest of lows. I mean, I think it was busy in the early days, but as it became normal, and I hate to say that, but as it became normal, I mean, I recognized in myself stressors that I didn't even realize I was carrying around. I mean, my shoulders were tight all the time, and that it slowly went away. And I thought, I feel awesome. Like, I feel better than I have in years. And why do I feel like this? And it's that again, that hamster wheel where, get up at 5, go to the gym, get to work, have my protein shake and an apple, work, rush hour traffic, home, take the kids to sports, like round and round. And then adding the pandemic to that, for me, I mean, it pushed me close to the edge a couple times. And I mean, there was one day, when I some of the stuff when I was listening to Doug talk, and it's like recognizing that point when you need help. And I mean, there was a day, and I remember like it was yesterday, I got out of my chair, middle of the afternoon. I didn't ask for permission or anything. I loaded my bike up and I went for a bike ride. And I can remember like it was yesterday. I saw a bluebird I'd never seen before. I saw a bear. I saw some big horned sheep, and I came home and I thought it was the greatest day in the universe. But 5 hours before that, I didn't know what tomorrow was going to hold. And I think the pandemic definitely took whatever stress we were already carrying and it just pushed it up a level. And I do think social media and the connectivity that we deal with and use every day, and it's effective, but there's barely any downtime. And I think the pandemic just took away whatever little downtime maybe we had, or like Doug said, took away some of the outlets that we're used to, whether it's a restaurant or a movie theater, it took those away from us. So I think it heightened the stresses that we're already carrying around.
Right. Okay. And just Doug, what do you think?
I think in some respects we were always carrying stress, but we maybe didn't even recognize that we were stressed out. I'm going to say one of the positives, if we can actually say there's a positive with the pandemic, it forced organizations and teams to actually start to really look at their how they're supporting their employees and their workforce in a work environment. And I think a lot of organizations really ramped up their employee support programs due to the pandemic that we never did before. So we go back many years when we had the SARS outbreak across the world. I remember that quite clearly, but we really didn't do a lot. It was here, have a mask, and just go about your business. And this pandemic really changed, I think, how organizations and people thought about supporting employee groups. And to Jody's point, yeah, I know I was fine. I was fortunate. I thought I was fine. I was fortunate that I was able to work from home, but again, recognizing the frontline staff, they couldn't. So how could we manage that? And we saw some challenges throughout that process on how we could really deliver a program and support them well. Difficult situation for sure.
Right. So I did some research into this working with a client. I ended up interviewing a number of frontline staff along with managers. And the frontline staff who I talked to actually said that coming into work every day was actually great because it kept them in their routine and that they didn't have to go home and dwell on everything. And so just the mere, I mean, Jody, I heard what you said about, having to get up at 5 and, work out, drink your protein shake and drive to work, et cetera, et cetera. So on one hand, I think we're all acknowledging that we're at this threshold where people they've been polling now saying the vast majority of people are going to quit their jobs because they've recognized that life is more important. So that's something you've touched on already, Jody. But again, like all the frontline security staff I talked to, or a lot of them said that they liked the fact that coming to work kept them motivated. So a question for first Doug, for you, and then for Jody. Were you seeing some staff who were, I'm not going to say enjoying it, but managing it quite well, and other staffs that were overwhelmed with it? Doug, did you see that split?
I did actually, and we had one individual who just chose not to work during the pandemic and self-identified and just they took the time off because they weren't prepared to expose themselves to an unknown virus at that time. But the other teams, what we did as part of our plan to minimize some of their stresses, we segregated teams. So if you're working at one particular location within the system, we kept that team there and we isolated them. So the fact that we had limited exposure to cross-purposing teams. So in the event that one staff member may became infected with the virus, it wouldn't impact the entire security team. So we tried to do that, and we tried to continue to message the supports out to the staff to reoccur that. And we'll talk about that, I think, earlier or in one of the questions here, is how we have to have how do you manage a program. But we did see, I didn't see a lot of negative feelings from staff early on. Being closed helped. The challenge was reopening. So staff became comfortable doing work behind the scenes, but didn't have to engage with the public per se. When the library reopened, now we had people that some were vaccinated, some weren't, and you still had to interact with them. And that caused a lot of stress for a lot of folks. And we did see a lot of people taking time off due to stress for that, for sure.
Right. Jody, did you see a split between those who managed it well and those who didn't?
Yeah, I mean, a lot of the frontline staff seemed to like the routine. When I did go into work, I often wondered, like, how could you, because we're virtually an empty building. We were a soft lockdown. Tenants could come in, but we're talking, a handful of people instead of thousands of people. So it was very small, but most of them were happy to be working, to have a job. They're working in an empty place, so it actually became a safer place. And where we saw the split for us was more of that mid-management level or supervisory level, where the supervisors felt like all of a sudden they were the top of the tree, where they used to have they could turn around and talk to a manager or talk to the property manager, ask questions. Those people weren't always available. And I mean, we would say we were, but it's like everything. I didn't want to call my manager. I would have to send a text or an email first. Are you busy? Is it okay to call? Where normally I would walk down to her office and just ask her a question. So I found more that mid-level supervisory management level struggled with it a bit more. Even it's funny when you were talking about that, about routine and that, though. Like I said, you get stuck in the hamster wheel, but at the same time, when the things kept changing, I mean, my wife said it to me a couple of times, if you tell me one more time you need a new routine, I'm going to kill you, because I need a new routine like this. I'm just sleeping in, so, I mean, I think the routine was good. I mean, in a lot of ways, there was some fear in the early days about getting on transit and was it safe to come out in public? And I think once people worked through that, the staying on a routine was really good for people.
Right. So Doug, so back to your point then. So when you did so you said one of the things you did was you isolated the teams and kept that, I guess, that for lack of a better word, cross contamination down. But what were you doing as an organization to help staff who were particularly stressed out beyond isolating them into individual teams? Like, what other tactics did you employ?
So, as I spoke about in my opening statement, we started with our initial PPE and so on and so forth, and we ramped up. So some of it was we actually installed physical barriers, plexiglass barriers for their work environment. So like our control center, we restricted access to our control center so we could limit the exposure to those teams that were working in the control center. But we also then started to engage external resources. So, and that's one of the components of building the program is to recognize what your organization's capacity is, and then to acknowledge that you may have to reach out to external resources. So certainly we had external resources brought in. We ensured that all the employees understood their employee assistant programs, how they could benefit. So those that we certainly identified that they were struggling with their work environment, with the stress, with the challenges they were facing. we supported them individually, and that's through the HR teams and their employee assistance programs, where we would have some counseling available to these individuals to help support them. Some of it was work accommodations. So those that might not feel comfortable being on the front line, we tried to reposition to see if there was other work available for them that they could do that didn't have them facing the public on an ongoing basis. And that was another piece of it, was rotating people. So you weren't always at that front piece where I said, please put a mask on, please sanitize, where you were constantly engaged with the public. We would rotate the teams and individuals through those roles, so where they could work behind the scenes and have some downtime and just be a regular team member and not have to face the public on a 24/7 basis.
Right, okay, thank you for that.
Yeah.
So Jody, I have a question for you. What advice would you give to a frontline security officer? And it doesn't have to be security per se, just a frontline employee whose employer doesn't have those options or doesn't care. They're like, if they're leaving these frontline staff just hanging out in the wind, like what advice would you have for them to help self-manage the stress?
Come work for me and we can help you out. But no, but serious, excuse me. I think a lot of it is being self-aware. I mean, you can reach out. These things are available through the healthcare system. So if you have a family doctor, and if you don't have a family doctor, you can, definitely utilize urgent care systems, and they can, find you some resources. They are out there. They're harder to find, obviously, if it's not through your workplace. I think for a lot of people is just being honest, and learning to deal with some of this stuff yourself and recognizing what you need to decompress. If it's yoga, if it's meditation, if it's somebody to talk to, and that it can be difficult, but I think, find those resources, find those people you can lean on, because they are out there if they're not through your workplace.
Right. I know for myself, I mean, I've been self-employed, for years now,
right,
at more than a decade. And I know when the pandemic was announced, back when it was in 2020, on one level for me, it was, it's just another day in the office, because I've been working from home for 12 years anyway. But I found that I would go through these mood swings, which I think you've mentioned too, that I had some highs and I had some lows. But I think what helped me was, through that whole lens of, I guess you could say, emotional intelligence, that self-awareness and that self-management, and you just talked about it. The first thing you have to do is say, you know what, I'm really stressed out right now. And I, I'm not trying to sound blasé about it. I think it's really important for people to be able to acknowledge that they're in a particularly stressful situation. And I just simply think acknowledging it will go a long way in helping to manage it. Then the next step is, okay, so I'm stressed out. So then what do I do? And I think, both you and Doug have said, self-care, go for a bike ride, go for a walk, seek out, a medical professional if you're able to, tap into family doctor. But even just being able to have a conversation with other people to say, you know what, I'm feeling particularly stressed out right now. So, on that note, a question for you, Jody, and then I want to flip this back to Doug. Like, did you have employees that no matter what you did and what resources you provided to them, they just seemed to be completely stressed out all the time?
We had a number of employees that, again, I think it went in waves. But hit some pretty high stress points periodically. And again, as an employer, we just had to continue to recommend the employee services. We did, I think something we did later on, maybe a year into this, was start to recognize, like, again, as a manager, there was periods of time when I just had to shut the computer off and get out of my house, go for a bike ride, take the dog for a walk, whatever it was. So recognizing that that's not just me. It's, everybody's probably feeling the same way. When I had a mid-level supervisor kind of reach that breaking point where, virtually I could see this person was ready to snap. I just say, take a couple days, like just leave. I don't, do you want me to take vacation days? Do you want me? No, just go away, go away for 2 days, go hiking, go do something, whatever it is. And, and that person a couple times, came back and said, that was awesome. Thank you for that. I sat at home, I read a book. I mean, maybe I couldn't go anywhere, but I got up, I set the alarm at 4:30 in the morning. I drove out to the mountains and I watched the sun come up, and, thank you for that. And so for me, it was recognizing, I was recognizing when I was having those breaking points, I needed to just go escape. And it is hard to escape. And it has been. So recognizing some of those people that were really challenging with it, and just, let's not go through the normal systems. You don't need to take a vacation. You don't need to call in sick. Just take a couple days, go decompress, find a way to get beyond it. And over and over, it paid off. And I think, it brought us closer together as a team. And I think it's as individuals, I think we'll hear over time people saying, like, I'm stronger coming out of this.
Right. So Doug, what about you? What were your experiences?
I didn't see a lot of that from my perspective with our teams, where people had reached the breaking point. We really emphasized a supportive culture. So anybody that identified, or that we identified, that was having some challenges, we quickly addressed it. But it was about being continuously supporting them. And I mean that from an organization, right from the senior leadership down to the front line, that all aspects of the organization continue to deliver the same message about a supportive culture and messaging. And that was consistent and still is today. Clear communication. And I think it really helped people to stay informed and helped minimize some of their stress, because they knew their employer was supportive and all aspects of the organization were acting it. So it wasn't just they were walking the walk, not just talk. So that was good. But Glenn, I'd like to go back to your last question really quickly, where you mentioned, for individuals that don't have a supportive work environment, or just didn't have that support available to them. The things that I think the individuals need to do is they need to understand what stress is, understand what that looks like and how that works. What causes you stress? What are your stressors? What are your trigger points? And when you're dealing with the general public, also maybe understand and put it into context, what might be stressing them out, and how can you manage that better? I know Glenn, you're going to put in some links after the fact for this session on some resources. And one of the really good ones that I personally used, and we delivered throughout the system, was something called the mental health continuum. And for those on the session today, if you just Google mental health continuum, you will get a chart. And it really is a great little tool to start for you to start to go, am I doing okay or not? And it's changes in mood, changes in how we think and attitude, our behavior, our physical changes, and I know, and I said I was fine because I could work from home, but I remember after taking the sessions and reading through this, and I was working from the dining room table one day, and I realized I wasn't well. I wasn't doing as good as I could. I was off. And that's what I told my wife. I said, I just feel off. And so because I was working from home, she's in the healthcare system, so she was at work. So I had all these other things that are just day-to-day normal activities. I had to take care of the dog. I had to get dinner ready. I had to do different things within the household that I traditionally we would collectively do after 5 p.m. or on the weekends. But now I felt a sense of I had to do that, and I was almost resentful for a bit. And just I started to get short with my spouse. It just felt different, and I reviewed this mental health continuum, and I went, you know what, that's it. And so then I started to look at some tools and say, okay, what do I need to do? So the first thing I did was acknowledge it and said, you know what, I don't think I'm quite right now. And I did that with my spouse, and we talked through it. And you know what, that helped a lot. Just talking through it with someone. So again, if you've got a colleague or a friend or a mentor, reach out to someone like that. So
right.
Yeah.
Well, great advice. Appreciate that. So another question I have is that, I mean, I've already mentioned it, but I'll bring it up again, is that lots and lots of surveys that have been conducted in the last several months, that's, you know, a year ago, the suggestion was that at the end of the pandemic, that about 30% of the people surveyed say that they were going to quit. And because, you know, for a number of reasons, biggest one, they came to realize they just weren't doing what they wanted to do, and that life was too short, and they wanted to actually pursue some kind of passion. I've seen numbers as high as 75, 80, 90% now. I'm just curious. So kind of a two-pronged question is, are you guys seeing like employees quit? And I'm not just talking about security staff. Are you just seeing in your capacity a turnover employees? And the second part to this question is, do you think that those companies who practiced, like put in place steps to help their staff manage COVID related stress, do you think that'll go a long way in keeping people from quitting? Like when they recognize that their employer actually cared for them. So Jody, I'll ask you the first question, which is, and mindful, we've got 4 minutes left here now. I have to wrap this up in 4 minutes. So the first question is, are you seeing people starting to quit yet?
No. We've had the lowest turnover that I've ever experienced in 30 years of security. I mean, people are not leaving. We did have a long-term employee leave. That was about a 10-year employee has gone to do a completely different career. Whether that was kind of bubbling under the surface or not before, will we see it? I think potentially. I think, like you say, with the support, I mean, we were very supportive through this, whether it was through Zoom calls and bringing in our head office executives to talk to the staff directly and stuff, went a long way. For me, I'm seeing positive things. I mean, we had this person that left was a team lead position. We posted that position and had 9 internal applicants. So for me, that's exciting. I mean, that's a lot of internal applicants that we would not have seen before. So that says to me, people were happy with the way that we supported them. They saw a future. They see positive growth within the security industry. So right now, I think it's good. Will we see turnover? Potentially. But again, people still need to work. Security, I think, is a great industry to be in, and lots of growth. So I'm not sure we'll see a massive turnover, but time will tell.
Okay. And Doug, how about yourself? Are you seeing turnover either with general library staff or city staff or with security staff at all?
So we've seen some turnover, and specifically with library staff, and part of that reason is because of provincial regulations where we had to open and close several times. Some staff chose to say, you know what, I need to work, and went elsewhere for employment just for that reason. From a security staff perspective, we did have some individuals who were redeployed during the last 18 months, and either chose to stay at that particular location, or they've got out of the industry and moved on to other career points. But we haven't seen a lot of turnover from our core team. In fact, I don't think we've actually had any departures. And what I'm hearing from our team and the feedback is they're not going anywhere.
Right.
Yeah.
Okay. just, I mean, we're getting close to the end here. So just final thoughts. So, flipping this back to Jody, what advice, I guess, can you give individuals to survive the next several months moving forward? What advice?
Sure. I mean, if you haven't taken time to reflect and really take a look at yourself, and again, I think, what does that mean? To me, it's, I guess a manager told me years ago, grab a 6-pack of beer and sit under a tree and figure out where the path lies. And whatever that looks like for you, if it's on a couch, if it's in the middle of the woods, and really taking some mental check on yourself and where that goes and where you want to go. And I think don't be afraid to speak up. And I hope through this, we talk about it, mental awareness and mental health, speak up. And I hope through this, we've normalized that a little bit where we're comfortable to say, I'm not having a good day. I don't feel good. I need help. What's wrong? I don't know. I need to go talk to somebody. And I hope through this, we're a little more open to talk about it and seek those resources and don't wait till it's too late.
Okay. Thank you for that. And Doug, closing statement.
Sure.
What advice can you give to our audience?
First off, I want to convey that you're not alone. You don't have to go through these challenges alone. There's resources out there. Think about your supervisors, your managers, family, friends, coworkers, professional services, your HR department. Look at all the online resources are out there, but the key message is you're not alone, and it's okay to not feel okay. And that's key, that you understand that it's okay not to feel okay. And reach out for help and know you're not alone with this. So just that's basically it, that you make sure that there's a lot of resources out there available for you. You just have to take advantage of them.
Okay. All right. Thank you. Thank you very much, both. I appreciate your time and expertise and sharing your experience with us today. And so this brings our webinar number 6 to a close. And I just want to remind people out there that our next webinar will be on August 18th at 0800 hours Mountain Daylight Time. And we'll be discussing the role of security supervisor. And so this brings our webinar to a close. So thank you both to our panelists and our attendees. So everybody take care of yourself, and we'll see you again soon.
Excellent. Thanks.
Thanks very much.
Okay, thank you. Bye.